Good evening, ladies and gentlemen, the public, and colleagues, and everyone on this virtual call. My name is Glenn Sylvester. I'm the current mayor of Daly City. Welcome to the regular meeting of the City Council. Today is Monday, April 13th, 2020, and I'd like to call this meeting to order. If we can all kindly please rise for the pledge to the flag, please. I pledge allegiance.
Allegiance to
to the
flag
flag of the
the
United
United
States
States of America, to the republic,
to the republic for which it
which
stands,
stands
one nation,
one nation,
under
under God,
Indivisible.
indivisible,
with liberty and
with
justice
liberty and justice
for
for
all.
all.
Okay, thank you very much. Madam City Clerk, are you online?
Unmute.
Yeah, there you go. You got it. Would you kindly call the roll, please?
Ms. DiGiovanni,
Present,
Ms. Manalo,
Present,
Dr. Rod,
Present.
Mr. Buenaventura,
Present.
Mr. Sylvester.
Present. Thank you very much. All right, the first item on the agenda is presentations. And with that being said, I'd like to turn the floor over to Mr. Alvin Desuado, Desuacito. Okay.
Despacito. Thank you, Mayor. Thank you.
Okay.
Thanks, everybody. I was called on to do a presentation by Justin Manalo, one of the council members. I have developed an app for contact tracing to help assist with COVID-19 coronavirus. And I wanted to present it here to the board of Daly City to see how we could use it to help Daly City citizens, especially the ones like the first responders, healthcare workers and stuff like that, so they could use this to help benefit them on an ongoing basis to help keep them safe and actually reduce the curve. You've heard the term flatten the curve. Contact tracing is something that can help reduce the curve or lower it, if you will. Would it be okay for me to share my screen for the presentation?
Sure.
Okay. Oh boy, I don't know how this is gonna look. Okay, let's share. All right, and where's my present? All right. So for those of you who are unaware, contact tracing is one of the tools that has been in the news lately to help help reduce the spread of coronavirus. Basically, what it is for those of you who don't know, it's when somebody is infected or test positive for the virus, they go to their healthcare practitioner, and when they test positive, they'll ask them to do a contact trace, which is who have they been in contact with in the last 10 to 14 days, and what places have they been to, and they use that information to notify people, to contact people, to see, to have them get tested or to check for symptoms and to help them slow down the spread. That's the current manual way of doing contact tracing. So what this app that I've developed does is it utilizes Apple and Google's technology in their phones to help reduce the curve of the COVID-19 coronavirus. The old way, like I just mentioned, is it's a resource-intensive, time-consuming interview that doctors have with their patients to say, where have you been, who have you been in contact with, and they pass that on to someone else who has to administer that contact trace, which then takes time away from them helping other patients as well. So again, that's the current or old way of doing contact tracing. Now, with an app that I've developed called Contact Tracing, it leverages GPS technology, Bluetooth proximity. It allows those who have been tested positive for the virus to anonymously notify people that they may have been in contact with. And it gives other people, other users, instant notifications on if they have been exposed to the virus based on their either their location or their Bluetooth contact history. I'm going to give you a sample situation here. So recently, I just read that someone at 99 Ranch tested positive for COVID-19. So in this real life example, if the infected worker had the contact tracing app, and any shopper who went to 99 Ranch at that time would then receive a notification saying, you may have been exposed to COVID-19 on whatever date that they were at that location. If again the time coincides with the worker who tested positive, and they would then use that info to take the necessary steps. Again, we're not saying that they actually have it, but again, just to take the steps, either self-quarantine, check for symptoms, get tested, contact your physician, right? It gives people an additional piece of information that they would not have had otherwise. And it allows people to be contacted, not just people that they know, but people that they don't know. Complete strangers would get notified because they've been in the same proximity as these people based on that technology. I could go through a walkthrough of the app if you guys would like, but basically what the app will contain is it'll show the recent events, places that may have been you may have been infected. It allows users to self-report. So if this is not yet integrated into the medical system, it allows users who have tested positive to self-report that they have been that they have tested positive. Those results will look different than those reported by actual medical and lab testing facilities. The way things are reported is all by QR code. So each of the users have their own unique QR code, and when they test positive, the medical practitioner will then scan the QR code with their app at the hospital's iPad or the hospital's devices. Will scan the QR code, and that will send the notifications automatically instant to people that they may have been in contact with. Basically, we're using technology to modernize the somewhat ancient practice of traditional contact tracing. So the next steps from here is the reason why I'm on this call, and the reason why I'm presenting is because I would like to have Daly City be the epicenter of this new movement to help digitize contact tracing. I want to see if you can help your essential workforce in Daly City, all the hospital workers at Seton, at Campus Drive, all the people who are still working, who are being exposed to the virus, first responders, fire, police, what have you. Every day there are people being reported having coronavirus. Now, if we had this tool in place, then the right people could get notified and be more aware and of whether or not they've been exposed to the virus. And the second thing that we could do also is help integrate this into the hospitals and medical and testing labs. So as I mentioned earlier, the way that you get the validated testing results from hospitals is after a positive test result from a hospital, a QR code will be scanned. So if there is a way that we can help integrate that into the medical facilities within Daly City, that would be great too. Otherwise, like I said, we still have the data from the self-reporting positive tested users. So at this time, that's the end of my presentation. If there's any questions, I'd be willing to answer them from any council member or anyone interested.
Does your app, oh, I'm sorry.
Thank you, Alvin. And with that, I'll open it up to my colleagues if they have any questions. Ray, was that you? Go ahead.
Yes. Will your app actually identify the person or persons who have COVID-19?
So the way that the data for the positive tested users gets into the app is two ways. It's self-reporting. So if a person hears from their doctor that they tested positive for coronavirus, they can then self-report that onto the app. The second way is integrating with medical facilities. So we would validate and create accounts for Seton doctors, for either each doctor or Seton as a whole, or doctors in Campus Drive. We would create accounts for them that they could then use their app to scan the QR codes of the patients to then denote them as being positively tested for the virus, and then the app handles the notification from there.
I guess what I'm asking is, will it actually give you a name? I'm concerned about privacy issues.
Yes, everyone is concerned with privacy, and everything on the app is nameless. There's no names or personally identifiable information on the app. So it will not declare a name. If somebody tested positive, it doesn't say you were infected by so-and-so. It's just, it'll give you that you may have been exposed and a date. So something where we eliminate any personal identifiable information in those notifications.
Okay, good. Thank you.
Mr. Mayor, may I?
Sure.
First of all, thank you for your presentation ahead of the game over here. This is Councilmember DiGiovanni, and similar to the questions of the Councilmember Buenaventura, but in regards to HIPAA. So, how is that in relation to HIPAA? Is it a violation? I mean, how does that work with HIPAA?
So yeah, we are currently working with HIPAA and getting HIPAA compliant. We want to ensure that the main reason why entities need to be HIPAA compliant is because of the personal identifiable information that's in other medical systems. But because we do not contain any personal identifiable information, it's kind of a different angle on it, I guess. And so what we would do is, we're looking into ensuring whether or not we need to be HIPAA compliant, and if we do, to make sure that everything is in accordance with HIPAA.
Yeah, and then what about hackable? Those that, are you going to have any kind of protection on that end?
I'm sorry, did you say
that people can't access
hackable? It? Yes. So all of the usernames and passwords are encrypted, 128-bit encryption on the back end. So we've done all of our due diligence to ensure that the information that we have, that we store is, no one can say it's 100% hacker proof, but we've done all that we can to ensure that that's the case.
Thank you. Thank you very much. Thank you for your presentation. Thank you.
All right. Anyone else? Questions?
I have a quick question. So in terms of like commercial use of movement, I know like corporations like Facebook, and they have these tracking devices that uses that data for commercial use. Can you guarantee that this type of tracking only specifically used for COVID-19 and health reasons, and that there's no way for commercial use in terms of tracking?
Dr. Rod, that's a great question. So to answer that simply is, in our privacy policy, the whole purpose and the objective of this app is for this virus, is for this COVID-19. And aside from that, we're not selling the information, we're not repurposing the information. It's strictly for that. In addition to that, that we have settings and privacy settings in place in the app. I wasn't able to show it because I wasn't sure how much time I have. I wanted to make sure that we have the questions addressed. But we have the ability for users to turn off the location on and off whenever they can. They can turn on and off Bluetooth whenever they can. They have an option to delete all location data within the app at any point. So the data is pretty much in the hands of the user. If they don't want us to have it, they delete it and it's gone, right? So we want to make sure that that's privacy and that information is concern number one, as well as the safety of our community, right? So we need to kind of ride that balance of privacy and community safety, basically.
Wow, that's an excellent question, Dr. Rod. Oh, that was a great one. I'm concerned also about GPS tracking, and someone can just turn off the information. Do you have a sample screenshot of a report that would generate the alert that would go out?
The alert, I do not have a screenshot available right now for the alert. Let me go back to sharing my screen and see what I can show here. Let's see. Everyone can see the screen. I had a screenshot here in the presentation. This is kind of a sample of data of what it would look like if a specific location that you may have been exposed to. So if you're looking at the screen and you go into the app, you can log in, you go into your recent events section here. And then here is a screenshot where at this point in time, at 11:23 a.m., you may have been exposed to COVID-19. And this is kind of not a instant notification, but this is when they can go into the app and take a look and see. If I were to click on this list view, I could show you a screenshot, but it would show you a list of the different locations that you may have been exposed, basically.
I see. Okay. Thank you.
Mm-hmm.
Okay, any other questions for Alvin from my colleagues?
Mayor, if
Yes.
I do have a question. Thank you for your presentation, Alvin. The question I have is, what would be the cost to the city or municipality or county that would, if they were to utilize this?
Yeah, that's a great question. And essentially, this has been a passion project of mine. I forgot to tell everyone my background. So I've been a software developer for, I don't know, over 20 something years. But most recently, I'm a teacher. So I teach kids how to type and code. And most recently, I've been at Marjorie Tobias Elementary School. So we do an in class coding session with them there. So that's kind of my background. Um,
Yeah.
and so this is a passion project of mine. And right now, what it is at this point, it's free for all Daly City citizens to use. It's free for any medical facility to set up their accounts. We're not in this to make money. This is really just to help out people, right? To help out the frontline workers, to help out medical and healthcare people. It's to help people stay safe. And so there's no charge for the app. It's available right now, actually, on Apple and Google Store. If you look up the name Contact Tracing, you can download the app now, and you can get start getting protected today, basically, right? But if we could have Daly City help, get this in front of more people and create a safer city for everyone, I think that would be a great movement.
Thank you, Alvin. Great question, Vice Mayor. We're always afraid to ask what the cost is. Great question. Thank you. Anyone else?
Well, I'm interested in let's get this rolling. I mean, how can we start doing this?
If that's a question to me, Ray. So I think the best thing for us to do is just organize and start contacting people who can help get the word out. I would advise maybe if we could schedule a meeting with me, and I could do a walkthrough or something like that with healthcare workers, with ER workers, with people who can really help immediately. I mean, considering that we're in a shelter in place, it isn't as effective if you think about it for people who are at home all day, right? Trying to keep the community safer. But those people who are out there, grocery workers, nurses, doctors, whoever, if there's a way that we can communicate this to them, I'm willing to spend my time to do a virtual presentation for them and to get them on board and to get them, safe.
That sounds great. So I don't know how do you if what the council feels, but I think we should move on this right away, right now. And Mayor, if you are so inclined, maybe
Huh?
you can appoint maybe like a subcommittee or something with Ms. Manalo as heading it and designating whoever you want to join. But I do think it's important that we do this now and not wait.
Thank you so much for that, Ray. Alvin, I see two apps. One's called Contact Tracing App, a digital declaration app, and the other is
Mhm.
Protect Yourself and Others.
Protect yourself and others is the one that is ours. Yes.
Okay, got it. Um, Thank you. Vice Mayor, you're the one who basically brought Alvin to us. And would you mind chairing a committee to help get the word out on this app?
Mr. Mayor, I don't mind at all. I know that this is of urgency to help folks be safe and understand how they can continue to ensure that there's safety against COVID-19. So I'm happy to do so, Mayor.
Thank you. As Alvin said, he's concerned about our public safety, healthcare workers, and especially with Seton Hospital coming on board. And if we can help and assist him in getting the information to these folks, I'm sure we can work with our city manager on public safety and the folks here at staff at Daly City as well. And that maybe even includes maybe contacting the county because we have these county calls every other Monday, Wednesdays, and Fridays, and at least just put the information out there. So, are you ready for this, Alvin?
Yeah, definitely, Mayor. I am ready for it. I've been ready since yesterday. And like I said, this is something I've been working on, and I really want to make a difference. And I think if it starts in Daly City and spreads from there, that would be great. That would be a great positive spread of something for once.
Great. Well, basically, I'll defer to you, Vice Mayor. If anybody would like to join the committee with the Vice Mayor in helping to get the word out, please, we're open. Stephen, I see you there. I know we can probably do something and assist as well with your social media skills as well. So I'll leave that up to the Vice Mayor to accept. And if anyone's interested in volunteering and assisting, that would be great. Okay. Great. So any further comments? Okay, Alvin, I try to be respectful and call you by your last name, but I'm having trouble pronouncing it. So I'll say Mr. D. So thank you, Mr. D, for your presentation, and we will stay in touch. All right, moving on to the next item is the approval of minutes for the special meeting of March 16th, 2020, and the regular meetings of February 24th and March 23rd. Do I have a motion to approve the minutes?
Motion to approve the minutes.
Motion by Councilmember Di Giovanni. Is there a second?
Second.
Second by Dr. Rod. Madam City Attorney, are you online?
Yes, I am.
Given that we're using the virtual mode here, do we have to take a roll call vote on every
Not
item?
for the minutes. You can take a voice vote.
Okay, thank you so much. So all those in favor of approval of the minutes say aye.
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 Any abstentions? Hearing none. Anyone opposed? Looks like it's unanimous. The minutes have been approved. Next, I'll entertain a motion for the approval of the agenda.
Motion to approve the agenda.
Motion by Vice Mayor. Is there a second?
Second.
Second by Dr. Rod. All those in favor say aye.
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 Any abstentions? It looks like there's no no's. The approval of the agenda is passed. Moving on to the approval of the consent agenda.
Motion to approve consent agenda, pulling items 5, 6, and 7.
Yes.
Okay, I have a motion to approve the agenda except for 5, 6, and 7. Are there any other items on the consent agenda that you would like to pull? Hearing none, is there a second on the approval of the consent agenda with the exceptions of items 5, 6, and 7? I need a second. I will second that. Okay.
Second.
All those in favor, say aye.
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 Any opposed? Any abstentions? Okay, we'll start off. The consent agenda has been approved. We'll start off with item number 5. Vice Mayor, did you want to start, or I can assist you, or I can start?
Sure, Mr. Mayor, I just pulled items 5, 6, and 7. You know, we definitely honor our employees and really admire their hard work that they've done for the city of Daly City, being definitely there on the ground in all the different roles. The pulling out of the items is at this juncture of COVID-19 in regards to ensuring, there's just some economic instability at this time, but I just want to understand the timing of when this would come into fruition, understanding where we are around our economic situation even locally, because of what's happening with COVID-19. So that's my question. I want to understand the timing of this and when this would actually come into implementation.
Thank you, Vice Mayor. Go ahead, Councilmember DiGiovanni.
Thank you, and thank you, Vice Mayor and Mayor. Yeah, along with that, if the mayor could elaborate or get the information on like the money already being allocated, and we want to make sure it's equitable. What is included in this item? Was it already allocated prior to this pandemic? How will that affect anything? And mine's more concerning not the ask me, but the 6 and the 7 for me. But at that time, whether more explanation, I'd appreciate it through the mayor when we had our prior discussion. Thank you so much, Mayor.
Thank you, Councilmember DiGiovanni. Anyone else on, well, we're taking each item separately. So starting off with number 5, we'll probably at some point group them all together, but it's going to require a separate vote on each. Is that right, Madam City Attorney?
Yes, that would be advisable.
Okay, great. What I'm hearing from my colleagues is, and I agree with you as well, given the current situation that we're facing now in Daly City, especially with the conditions, there are many folks who are out of work, and it's no fault of their own. And for those who do not have work, and obviously there are many out there who are struggling at this time, and the image and the perception of Daly City is very important to our community. So this is a time where we have to provide full and complete transparency to our community. I definitely agree that showing a pay raise to our staff who are deserving, but yet at the same time, there are many who have lost pay, who are struggling during this pandemic, and again, through no fault of their own. So if I can make the following points available to everyone. First of all, what you have on the agenda tonight are 3 bargaining units. I believe Daly City has close to 11, and these are the last remaining 3. In regards to Ask Me, they have been waiting. They have been going back and forth on the negotiating with our negotiator and staff. The Ask Me agreement before you is consistent with all other settlements reached by all the other units throughout Daly City. This agreement actually contains concessions and improvements. And when I say improvements, basically it's improvements to help the lowest paid workers in our city. So to fall back on what we have negotiated with the Ask Me group, you basically would probably put the city at risk legally, because it would be said that we did not negotiate in good faith. So basically, these monies, which was already allocated for, it's already in the budget, and it'd be a good reason to move forward and not delay and go ahead and pass this resolution. Are there any questions?
No, thank you for that explanation, Mayor. With that explanation, I have no further questions, and I move to adopt item number 5.
Second.
Okay, we have a first and a second. So, okay, motion on the floor, first and a second. Any further discussion? All those in with roll
Let's hear
call?
roll call.
Okay, roll call, please, Madam Clerk.
Ms. DiGiovanni,
Aye.
Ms. Manalo,
Aye.
Dr. Rod,
Aye.
Mr. Buenaventura,
Aye.
Mr. Sylvester.
Aye. Okay, the motion passes. Thank you very much. Moving on to item number 6. Item number 6 is a resolution adopting salary and benefits for the miscellaneous and unrepresented employees. Vice Mayor.
Yes, for item number 7, I do have a question within this realm.
Vice Mayor. Vice
Oh,
Mayor,
sorry, I'm on mute. Okay.
Number 6.
Can you hear me now?
I can hear you. Number 6, Vice Mayor.
Yes, number 6. I do have a question on the item number 6, the salary benefits for miscellaneous and underrepresented employees.
Mhm.
It's around the same issue of timing, but you have answered that, Mr. Mayor, through your elaboration on item number 5. So I'm happy to move on that item if there are no other questions.
Thank you, Vice Mayor. Are there any other questions? Okay, I would like to add in regards to our miscellaneous unrepresented group. These folks contain some of our lowest paid employees. This group historically has received the same compensation as the represented groups once that process is completed with the represented group. They are the next to last group to get what other city employees have gotten. So throughout the negotiation process, we have tried and we have done our best to maintain fairness and equity throughout the for all staff. I mean, well, fairness basically. And here, what we're looking at is the cost of living increases for our miscellaneous unrepresented group. Okay, are there any other questions? Okay, Vice Mayor Manalo has moved forward with item number 6. Is there a second?
Second.
Second.
Thank you, Dr. Rod. Okay, any further discussion? Okay, if we can have roll call, please.
Ms. DiGiovanni,
Aye.
Ms. Manalo,
Aye.
Dr. Rod,
Aye.
Mr. Buenaventura,
Aye.
Mr. Sylvester.
Aye. Thank you so much. That resolution is passed. Moving on to the last item on the consent agenda, that's item number 7, and I'll defer to the Vice Mayor to start.
Thank you, Mr. Mayor. On this item, item number 7, when looking at the information provided by the city manager's office, there was a question regarding the city treasurer and city clerk. In that respect, I know it's lumped in with executive management, but seeing that the city treasurer and city clerk are elected roles, I think that needs to be parsed out in ensuring that there is clarity and it just makes it as far as execution, at least it's organized in a fashion where I don't think that the city treasurer or city clerk should be lumped in with executive management as elected roles per se. So that is my issue there.
All right, thank you so much. Councilmember DiGiovanni?
Yeah, thank you. Yeah, thank you, Vice Mayor. And in that, if we vote to do that, the city treasurer and city clerk, my question is, do we still vote separately tonight that they also get the cost of living? Or how does that work? And secondly, we are voting on item number 7 only. Would you mind, Mr. Mayor, explaining that it's a cost of living and not an adjustment, and that the adjustment will not come until September? And for more clarification on 2020, that on this particular item is cost of living only.
Thank you, Councilmember DiGiovanni. Before I even attempt to answer some of those questions,
Oh, thank you.
I'm going to defer to the city attorney on the first point. And I believe that's parsing out the elected officials from executive management. Is that correct?
That is my request, Mr. Mayor. I think that it makes sense to do so yeah, because it's lumped in with executive management. These are elected positions by the people, both the city treasurer and city clerk. And I think that in administration wise and even within us, our adoption, and I think it should have its own section.
Thank you, Vice Mayor. Madam City Attorney.
Sure. And before I respond, I just wanted to get a clarification. So the item before you this evening is the approval, consideration of resolution for executive management, including city clerk and city treasurer. Is the request to approve the resolution this evening, to consider the resolution this evening for executive management and to have it separated for also consideration for this evening, or to have the elected officials at another time?
That was my question.
Yeah, I think, I mean, for me, I think at this point, even given the fact of where we're at this time in this crisis, I think that we would do this. I would recommend doing this at a different council meeting and doing this moving forward, where there would be an area just for the elected officials, and not in congruent with the city administration.
Okay, so the request would be to consider resolution adopting the cost of living adjustment for the city treasurer and the city clerk to be considered at a different time.
Yes, and to be clear, it's the elected roles, not the workers. The elected roles, meaning specifically city treasurer, specifically city clerk.
Okay.
Councilmember Di Giovanni, I think that was along the lines. I am going to address the other part, the
Thank you.
equity that you had questioned, but hopefully I understood your question for the city attorney. Did I get that?
Yeah, thank you. Yes, thank you, Mayor. The clarification is that we are going to take this and maybe put it on for the city treasurer and city clerk, because they're elected, and rightfully so. They should be in a separate category. But we will be bringing it back at perhaps the next council meeting. Is that correct, Mayor or Vice Mayor?
I would have to defer to the city manager and the city attorney as to when they can get this agendized and a follow-up provided.
Oh, okay. Thank you.
I can interject, and I'll be working with Rose on elected official compensation in general. I doubt that we'll make it on the April 27th meeting, but the summer for sure. Maybe, where are we? It's now April, so maybe May or early June.
Thank you so much. All right, to address the issue that Councilmember Di Giovanni brought up also, as you know, item number 7, the information contained within item number 7 contains a cost of living adjustment only. Apparently, it was at the request of our city manager, given at this particular time, even though our executive management is underpaid in comparison with other jurisdictions, but it is felt that we should not pursue the equity portion of adjustment. All the other equity adjustments that we've made for the other groups, a study was conducted, and mostly in all cases, if they were 8% or more under market, they received an equity adjustment of up to 2%. Well, here for the executive management, they are not receiving an equity adjustment, even though they may be below. However, let it be known that once this is over, we will revisit it at that time to decide. And folks out there in the community should also know that if jobs have to be cut, or salaries, basically, whose salary is going to be cut first? It's the executive management and not the folks below. So I think that's a good point to bring out. They understand that if you have to give up something, and which they are right now, and that's the equity portion, they want to keep working, but their jobs, their salaries are on the line to be cut first. And our city manager can attest to that. Shauna?
Thank you, sir. I don't know that I have much more to add. You were very eloquent in that. I understand that the timing of all of these items are sensitive, and we're working so hard to get our community what they need right now, even though our services look different. But you've hit it. We have an amazing workforce at all levels. Our executive team is right up there as far as their worth. I thought that the optics right now are such that we'll look at equity if the budget affords it later this year, but that was not a good time. But I do believe that the cost of living adjustments for all rank and file is warranted. And I did confirm earlier with financial staff that it was budgeted. So, and I think you make a great point that that the executive management group, being a non-bargaining group, would be the first to relinquish any salary adjustments. And honestly, they would do it gladly.
Thank you, Madam City Manager. Thank you for that basically vote of confidence. And I believe we feel you, and we know our executive management, and we know how hard they work and how much they would sacrifice for this city, especially at this particular time. I saw a momentary hand up by Councilmember Di Giovanni. Did you want to add anything else?
No, other than I appreciate the clarity, city attorney, city manager, mayor, vice mayor, because we just want to make sure that people know that, like you said, transparency, that the money had already been allocated. It's not money that has been used for something else, and that this indeed is only the cost of living for these people. They are not getting anything, and it will not come before us before hopefully the end of the September will be the end of this COVID situation, and when that will come back. And I'm sure city manager will be taking note of that. So thank you very much to all of you.
Thank you very much, Councilmember Di Giovanni. All right, are there any other questions or comments on item number 7?
Mr. Mayor, I do have another comment, if I may.
Yes, please, Vice Mayor.
Thank you very much. I just want to say thank you to Shauna with her foresight around moving, the equity adjustments for executive management. It's not on the docket this evening because of realizing where we are at the moment and looking towards September. I mean, that is really leadership and taking it upon kind of where we're at the moment. And so I just want to say thank you for that foresight and your commitment to the city of Daly City. And to all the workers that are doing their extremely hard work right now. I know there's a lot of different moving parts as we work together and ensure that our communities are safe and the neighborhoods are safe, and really working in so many facets during this crisis. So I just wanted to say thank you. And this is definitely something that I agree with at this time. And it shows our community in the city of Daly City that, there is a sacrifice and understanding of where we are in this moment. So thank you.
Thank you, Vice Mayor. Councilmember Di Giovanni, I see you coming in and out. Did you have any final comments?
Oh, no, thank you. Thank you very much.
All
Thank
right.
you.
Thank you. So with that being said, I'll entertain a motion. Basically, I would hope Vice Mayor would make a motion for item number 7.
Sure. I make a motion. Well, what's the best way to
So,
approach
if I-
this?
Through the
Yes.
chair, if the recommended action is a resolution of the city council to adopt executive management salary, that would be the motion.
Okay.
Okay.
Motion to adopt.
I want to interject a little bit. Do we want to talk about the
Yeah.
elected official aspect?
Yes, so my understanding based on the discussion is the consideration for the elected city clerk and the elected city treasurer will be considered at another time. So it will be brought back to the table for consideration sometime in June or July. Is that correct?
Yeah, yes.
Okay.
And I think in moving forward that this should be the practice in when adopting salary schedules, et cetera, that the city treasurer and city clerk fall under a separate category and not with executive management moving forward.
Okay, so we would have considerations for 2 separate resolutions. So the consideration this evening would be resolution adopting salary schedule and benefits for executive management employees. Is that correct?
It's for the it's for the
Executive management employees.
management employees. What we have stated for COLA.
Okay.
Yeah, and so and then so would that be 2 motions or one?
No, basically we would just have the resolution for the salary and benefits for executive management employees as the resolution for this evening. And the consideration for city treasurer and city clerk does not need to be a motion. We will bring it back to the council for consideration at another time.
Okay, thank you so much. I guess when we bring it back, if we can do it quickly.
Yes, we can.
Excuse me. I think that would help. And if you can provide us any information, I believe there was a resolution in the past lumping the folks all together, and looks like we may have to make a change if we go down this path.
Thank you, Mayor. This is Shauna. I think we can do it sooner than July. Rose and
Hey.
Steve and I will be working in the next week or so to package this up. So I'm hopeful we'll get it to you by May-ish.
Okay, perfect.
Great.
And city, I have a question for, if I may, through you, Mayor. May I ask a question directly to City Manager?
Absolutely, Vice Mayor.
Thank you very much. And with that, when you do provide the new resolution or so, can we ensure that this is the practice? I don't know how you would do that within the resolution, but making sure that as we move forward, it's parsed out.
Absolutely. And I think staff would appreciate that clarification and distinction. So no problem.
Thank you very much.
Okay, Councilmember DiGiovanni.
I'm good. Thank you. Thank you so much.
Okay, getting back to the motion, Vice Mayor, did you make the motion? Has that been clarified for you?
Yes.
Okay, that has, is there a second? I will second the motion. May I have a roll call, please?
Ms. DiGiovanni,
Aye.
Ms. Manalo,
Aye.
Dr. Rod,
Aye.
Mr. Buenaventura,
Aye.
Mr. Sylvester.
Aye. Okay, the motion passes. That's the end of the consent agenda. Moving on to item number 11. Oh, okay, moving on to item number 11. For the public to, you've been given an opportunity to provide questions, and we do have a couple, and I'm gonna, at the appropriate time, I'm gonna have Mr. Solti read or explain some of the questions that may have come in on particular items. So we're gonna move into item number 11. And finding of public convenience and necessity, PCN-10-18-13, 729, to sell alcoholic beverages for off-site consumption at Target at 100 Westlake Center. And with that said, I'll turn it over to Mr. Palin. Mr. Palin, let me
Hear
see.
me? I think my video was turned off.
That's okay. I can hear you though. We can.
Okay, should I turn the video on, or does Steve
Sure.
need-
Sure. You probably have some slides or something.
I don't for this project. Let me try this. Hold on, I'm learning this. Okay, here we go. Okay, I think Stephen has disabled my video. It says the host has disabled my video, so I'll just do it without video, with audio only. So, Mr. Mayor and council members, Target Stores is requesting a Type 21 license from Alcoholic Beverage Control, ABC, for the sale of beer, wine, and distilled spirits for off-site consumption at their new location at 100 Westlake Center. ABC requires a determination of public convenience and necessity when the site is located in a high crime reporting district. ABC defines high crime reporting district as one where there is a 20% greater number of reported crimes than the average for other districts within the jurisdiction. The Daly City Police Department has reported 10 alcohol-related crimes in this district between July 1st of 2018 and June 30th of 2019. Additionally, we have had a comment from the public that I received. I'm not sure if this person has sent in their comment to share also, so I will just briefly discuss that. The comment from the public is from a youth organization called JCYC, and they're concerned that since Target is a family-oriented store, that the sale of liquor would potentially create easier access to underage people for underage access to liquor. So I that came in via email, and I wanted to share that with you as a concern from the public. I'm not sure if they have written in where you would be going over that comment. So this concludes staff's presentation on the project, and I believe the applicant is also joined in on the video feed to answer any questions if you have some questions directly for the applicant. Thank you.
Thank you, Mr. Palin. We do have the applicant online.
Yes, Beth.
Yes. Okay. I see you. Good evening.
Good evening.
What I'm going to do first is I'm going to turn it over to my colleagues if they have any questions. Be advised, we do have the applicant here online to answer some of the questions that you may have. At the last meeting, I did have an opportunity, or a few council members had the opportunity to ask some questions, but here's another opportunity for those who weren't here to ask questions. So with that being said, I'll open it up to my colleagues to ask the applicant any questions.
Mr. Mayor?
Councilmember DiGiovanni, please.
Yeah, first, thank you very much, Mr. Palin, for the presentation. Is that the whole, when you read that, is that the whole thing that the JCY, that organization, is that the read verbatim?
No, I'd be happy to read the email to you.
Okay.
Okay. It says, thank you, City Council members, for allowing me a chance to speak today.
Mr. Palin?
I wanted.
Hello, Mr. Palin, hold on for a second. Councilmember DiGiovanni, I believe Stephen has the correspondences.
Okay.
Uh,
Okay, I apologize.
I think he's going to, we're going to give him an opportunity to read each one. Would that be okay?
Yeah, I apologize, Mayor, because
Oh.
it's hard visually. And then the second thing was to ask the representative from Target a question.
Okay, yeah, you have the floor, Mr. Giovanni.
Okay, thank you. Thank you very much for being online with us. And I think this was asked by Dr. Rod before, so I don't want to step on his toes. But I think at the prior meeting, I believe he asked something about what type of alcohol you were selling. Was it hard liquor and was it locked? Will it be locked?
Hi, my name is Aubrey Vance. I'm actually the store director for the new
Oh,
Target.
sorry about that.
So I just wanted to hop on and introduce myself, and that way I could answer any questions. First of all, thank you for having me at the meeting. Me and my whole store have had a really super warm welcome from the community. So the license is for beer, wine, and hard liquor. We do have an in-view system, which is a one-key system where bottles have caps on them that you have to have an electronic key to open. So it will be secured liquor. And then, of course, beer and wine would be open.
Thank you.
Okay.
But not secured, locked in a cabinet, correct?
Correct. No, the locking devices would be on the individual bottles.
Okay, thank you.
Thank you. Any other thoughts?
Yes, I
Questions?
have a question, Mr. Mayor.
Councilmember Buenaventura, is that you?
Yes, that's me.
Yes, sir. Go ahead.
Is the standard a finding of public convenience and necessity, or is it public convenience or necessity?
I'd be happy to respond to that. The standard is public convenience or necessity.
Okay.
We could make a finding of it's publicly convenient, but not necessarily necessary then. Okay, got it. Oh, I have another question. Can you, my understanding of that area is that Safeway allows for all the categories that Target is going to be selling, meaning beer, wine, hard liquor. I think Trader Joe's also sells alcohol, though I'm not really sure what kind. And I also think that, isn't the gas station across the street, Chevron, I think they sell beer. And I actually think Walgreens even sells beer and wine. And so is that about right in terms of the market and the competition? That's the stores that do sell them in that area, or is there any more?
To my knowledge, that's the only stores around us that have alcohol or liquor in them.
Okay. And then is your, obviously as Target, you're going to be competing in the market. So I would think your goal would be to offer the best price for the consumer based in part on what the market is. Is that right?
Correct. And just a little background around that too. Anybody that hasn't had the opportunity to swing by, we're actually a small format Target. So we're closer to the Stonestown model than Saramonte or Colma. So it's aimed at convenience. The entire first floor is essentials and grocery with a small apparel floor pad. So that's one of our focuses in business is grocery and essentials. The second floor, healthcare and beauty is our main focus. So we have very limited departments otherwise. So our goal as a store and as a small format is to be that convenient one-stop grocery store. And that is the majority of what our business has done. We've been open a little over a month now, and 75% of our business has been through healthcare, grocery, and essentials, 60% of that being grocery and essentials.
Okay, thank you.
I would like to put a question out to Mr. Palin or Ms. Abu Lafia. Can you reiterate, based upon the particular area, that how many licenses are available and how many are in use at this time? Either one of you can answer that.
Give me a moment. I need to verify that information.
Okay.
Well,
Abu Lafia, I think you brought that up the last time.
sure. There are, I think this is what you're referring to, the allowable number of licenses for the census tract that the Target store in the shopping center is in is 4. And there are currently 3 existing in the census tract. So it is not considered oversaturated.
Thank you. Mr. Palin?
That matches with the information I have.
Okay, thank you so much. I'm sorry, I got to get back to the screen. I lost you folks. All right, are there any other questions for the applicant before we open it up to the public for comments that we have had on this subject?
Mr. Mayor, just a couple more, just real quick.
Sure.
I believe this is directed for the Target representatives. I believe on the last, correct me if I'm wrong, that it's when I think one of us asked about the percentage of sales that that it would bring in for Target, and approximately was it 10%?
I believe that it's much less than that. Typically, it's closer to under 5% typically.
Okay, thank you. And then also the ABC defines a high crime reporting district as one as a 20% greater number. I think we did this the last time of reported crimes within the average number of reported crimes. And then I think we determined that it was a higher level than the 20% according to the ABC. I don't know. Go ahead. I'm sorry.
Yeah, so
Mr. Mayor, do you recollect that?
I do recollect that. So the numbers were a bit confusing because the total number of reported crimes was greater than 20% more than the average for other jurisdictions within Daly City. But the timeline on that total number of reported crimes was unclear. Additionally, when I verified that information with the police department, they said that was all crimes, many of which having nothing to do with the sale of alcoholic beverages. They specifically had said that there were 10 violations in that census tract regarding alcoholic beverage sales.
Okay, thank you. Because I remember saying that I have been in Safeway where people just roll out and steal the alcohol anyway. So that's definitely not even reported, I believe. Yeah. So that was bothersome to me. Not saying it would happen at Target, but I do know that sometimes it does happen where, you know, the police are not called at that particular time when people are rolling out with a basket of liquor. So, but anyway, thank you very much. I appreciate that, Ms. Coleman.
Thank you, Councilmember DiGiovanni.
Yeah, thank you, Mayor.
Oh, sure.
I would also, if I might, Mr. Vance can speak further to this, but Target has, you know, very extensive protocols and safeguards in place to make sure that the store remains safe and has security measures in place, not just with respect to alcohol, but just in general with respect to taking care of their store. And I would also add that the police department, in this case, the Daly City Police Department, has not expressed any concerns or objections to the issuance of the license to Target.
Thank you. I remembered the protocol issue about the security and I think another question was raised before. Out of the total square footage, what was the footprint of the actual display? How many
Mhm.
square feet?
It's
Roughly.
it's less than 3% of the
Yeah.
overall sales floor area.
Gotcha. Okay. Any other questions for the applicant at this time before we open it up to the public and comments?
I do have a question. Did I miss exactly where the location will be in the store?
Nope. So the location is in the back left corner of the store. So it's not near the front doors. And then, like I said, grocery and essentials is the first floor. So anything else would be upstairs.
Okay. And like what aisle would it be next to? Sorry, just wondering where it would, like, what is near kind of the alcohol line, aisle, etc.
So our freezer section backs up to it. So it would be the freezer section on one side and then soda, drinks, and bottled water to the right of it. So as it's in the corner near the elevator, it's just in the back kind of on its own.
Okay. And then is it did you say that you needed a key card or so?
No.
It's called an in-view system, but yes,
Yeah.
it's an electronic key that you have to get the lid off of it, so it attaches over the top of it.
Okay, so there is a protection. I've seen that in some stores where like you literally, like, it's covered and then you actually need a key to get the items. Is that correct?
Yes, correct.
Okay. Okay. Thank you very much.
Oh,
Councilmember.
Mr. Mayor, for
Yeah.
clarification, is it locked up? I thought it wasn't locked up. I thought it was just the lid of the alcohol itself that was locked up. Would he clarify that? It's not locked up, like behind where you had to wait for somebody to come and unlock a cabinet. Is that correct?
Correct. I was saying it's individually locked in the cap.
But not in the cabinet?
On the cap, no.
On
It's
the
not
cap.
yes.
Okay. Yeah, because clarification, because our vice mayor was unable to be at the last thing. Yeah, so it's not in a cabinet, but it's the lock of a cap, maybe whiskey or bourbon or similar to that, the cap itself. Thank you so much.
Okay, any other questions? Okay, at this time, I'll defer to Stephen. Do we have any public comments on this, Stephen?
Yes, we have 3 comments that were written in to the city clerk in advance from JCYC, and we have 1 comment on our virtual meeting page.
Okay, so at this time, would it be appropriate I open up to these comments at this time, and I assume you'll read the comments?
Yes, I can just start with the emails that we received in advance. The first one is from Danelle Go. She's a youth leadership specialist at JCYC. And it says, "Good afternoon. I hope you are doing well during this time." She's submitting comment for this item. "Thank you for your time. I hope you are all taking care and doing well during this time. My name is Danielle Go. I am a youth leadership specialist of the Daly City Prevention Collaborative, a program focused on substance abuse prevention."
What's this at?
Oh, it's long, so that's why.
Oh, sorry.
But I can slow down a little bit. Education and programming with youth in Daly City. Our goal is to educate youth on the varying risks that come with substance use and guiding them to make healthy life decisions. It can be challenging to guide youth on healthier life decisions if there is a constant exposure to risk and substances in their everyday lives. However, we need to work in collaboration and with the support of the decision makers of our city to reduce and lessen the exposure to alcohol and the rising number of liquor licenses in our community. We can start by lessening exposure in everyday places. Families and children shop. When it comes to the Westlake Shopping Center, there is already a high traffic rate of families and children that come to the center, yet alone Target. In addition, there is already a Walgreens, Trader Joe's, and Safeway that sells alcohol. Therefore, there is no need or necessity for another store to support off-site alcohol consumption and sales. My students have expressed to me that students within the area like to hang out at Westlake Center after school and stop by Target for a snack, get school supplies, etc. Why do they need another store exposing them to alcohol and being accessible? Also, within close proximity, there are schools, a park, residential areas, and stores that tailor to serving kids, such as Kumon Learning Center, GameStop, Color Me Mine, etc. Rather than increasing the exposure and sales of alcohol, as this Daly City Council members, you should consider limiting liquor license in areas that many families and children go to. We are here to protect the community and create a safe community where future generations can thrive, living healthy lives. Taking these precautionary measures now is way more necessary than the convenience of buying alcohol at the same store where someone is buying school supplies with their children. Thank you for your time. The next one is from another member of JCYC. It says, I'm Debbie Irawan with the Japanese Community Youth Council in San Francisco. We've begun implementing substance use prevention services to youth in Daly City for the past 3 years. We are working to build a better community for the youth of Daly City. Low-income people, people of color, and youth are most vulnerable to the negative health and safety impacts of alcohol. We don't need more places selling alcohol in our communities. Many families with young children shop at Westlake Center, and many young people hang out with their friends there. Reducing alcohol access will reduce the impacts of alcohol-related harms, including crime. Alcohol use is not an individual issue, it is a community justice issue. Everyone deserves a safe and healthy environment to grow and thrive. And then the last one that we received in advance is also from JCYC. Thank you, City Council members, for allowing me a chance to speak today. This is Mikio Akima. I wanted to address the Type 21 license application that the Target at Westlake Shopping Center has recently applied for. In thinking over this decision, please consider the following. Target is a hotspot for families as it contains a variety of all the basic living necessities. This means that people of all ages, old and young, will be wandering through the store, thus increasing the likelihood children will be exposed to alcohol advertising. Other supermarkets in the area, such as Trader Joe's and Safeway, are already licensed to sell alcohol, which contradicts the claim that selling alcohol at Target is a necessity. The constant battle to reduce youth consumption of alcohol will only become more challenging if we allow more non-liquor stores to carry alcohol, especially if these stores are accessible to youth and families. We do not want our children to be wandering from the toy section to the wine aisle. Please take this into consideration when making your decision. Thank you again for this opportunity to be heard, and I look forward to your decision upon this matter. And thank you for your services during this crazy time. And we have one more comment that we received online, and it is from Donald Jung. And it says, hello, Daly City Council. I am a frequent shopper at the Target located at 100 Westlake Center, and I always see our beautiful youth in the area and inside this Target. Having images of alcohol ingrained in their heads won't help with prevention in the future. This doesn't go to say that consuming alcohol is bad, but we have plenty of outlets in the plaza to purchase already. With that being said, I don't think it is necessary to approve of Target's request for selling alcoholic beverages. And that concludes the comments on this item.
Thank you, Stephen. I'd like to reach back to Mr. Palin. Any of the correspondence you've heard thus far, do you have anything different? I know you were about to read one.
No, the one that I was about to read, Stephen read.
Thank you so much. Okay, you've heard the comments. We're going to close the public hearing at this time. Are there any further questions that my colleagues have in this matter, comments or suggestions?
I move to approve the item.
Okay, is there a second? I will make that second. Okay, motion and a second. Any further discussion at this time? And Madam City Attorney, yeah, this requires a roll call.
Roll call, yes, please.
Adopt resolution by roll call. Okay, may I have a roll call, please?
Ms. DiGiovanni,
No.
Ms. Manalo,
Aye.
Dr. Rod,
No.
Mr. Buenaventura,
Aye.
Mr. Sylvester.
Aye. Okay, thank you. Mr. Morgan, thank you. And Ms. Beth Abulafia, thank you so much.
Thank you very much.
All right. Okay, moving on to the next item, resolutions. Item number 12, adopting resolution or authorizing the city manager to defer rental payments for tenants of city-owned properties on a temporary basis as may be warranted due to the shelter-in-place order. And I'll turn it over to our city manager, Ms. Maltby, and city attorney, Ms. Zimmerman.
Thank you, Mr. Mayor. I will present on this item. As you are aware, on March 16, 2020, the County of San Mateo did issue an order shelter in place. The county also issued a moratorium as it pertains to residential properties in the counties of San Mateo. And as a direct result of the shelter in place and also the substantial income losses that have occurred on our city properties, we are proposing that the city that owns 13 properties throughout the city under current leases, both private and public entities, request, if needed, any deferral of properties to extend at the discretion of the city manager. We recommend that the authorization or her designee would include that the property owners, the leaseholders would request a deferral. And again, this is a deferral. This is consistent with the residential moratorium at this time to help in terms of some of them are not conducting businesses, are not in their lease spaces currently right now. And we realize this is a temporary basis that is going on throughout our city. So we thought that this would be helpful in terms of defraying some of those substantial income losses. The intent is that the shelter in place order currently is up until May 1st, 2020. If this were to continue, it would be at the discretion of the city manager, and we would request that the leaseholder would request how much payments that they would need to defer it up until 90 days past the shelter in place order. We want it to be sort of discretionary in a sense that they will be responsible for these payments. So we don't want to have them where they're looking at 6 months of unpaid deferral as a result of the shelter in place. That being said, once a request is made to the city manager, I will issue a notice and an agreement that the city manager will sign, and we will keep track of those deferral payments as they come. I'm available for any questions that the council may have. I think you're Mike. Okay,
Thank
there
you,
you go.
Madam City Attorney. Do I have any questions from my colleagues?
Mr. Mayor, just a clarification. I believe, because I think Stephen's going to read the public comment, I think there was some confusion. People were actually thinking that this is that this item was a residential, like apartments or similar to that. So for clarification, I appreciate that City Attorney made it clear that it is not residential. Is that correct?
These pertain to our city-owned facilities and leases that we have. Yes.
Thank you.
All right.
For those that, for those that were concerned and constituents out there, community, they thought it was residential. Thank you so much.
Okay.
I'm unaware of any comments or letters that came in. So that will be the next when I open it up to public hearing, where I'll ask if we have any additional information. Any other questions for Madam City Attorney? Hearing none, I'll defer to Stephen. Have we received any comments or letters on this particular item?
No, we did not receive anything on this particular item. I think what Councilmember DiGiovanni is referring to is an email that the city clerk received regarding back rent for residential. It's not something that I plan to read out loud. It's pretty long, and you all have it in your inboxes as well, but I defer to you if you want me to.
Yeah, I believe that is for the public comment period.
Yeah, that's for public comment coming.
Right. Yeah. Not for this item.
Right.
Okay. So just a clarification, if I may, it says city-owned properties on a temporary basis. So this does not apply to residences because residence already comes under the governor's order.
That's correct. This is for our leases.
Okay. And
our own city leases on our city properties.
And do we have city property to which folks are living in there as residents?
We do have one.
Okay,
And I believe it is listed on
okay,
the attachment Exhibit A.
okay. And,
And
okay,
that would also, we included that as well. It is all for just city-owned properties.
okay, okay. So you can basically classify that as commercial because they're renting. Yes? No?
Well,
Well,
they're renting one of our facilities, yeah.
gotcha. All right. So it's clarification. It's just a deferral
That is
and
correct.
not a what do you call it? Forbearance or
Or
forgiveness?
a waiver.
A waiver. All right. Thank you. All right. Any other questions for the city attorney on item number 12? Okay, hearing none. Public hearing is open and closed. I'll entertain a motion to adopt the resolution, item number 12.
Motion to adopt resolution for item number 12.
Thank you, Vice Mayor. Is the motion, is there a second?
Second.
Second by Dr. Rod. Okay, may I have a roll call, please?
Ms. DiGiovanni,
Aye.
Ms. Manalo, Ms. Manalo,
Oh, it was on mute. Aye.
Dr. Rod,
Aye.
Mr. Buenaventura,
Aye.
Mr. Sylvester.
Aye. Thank you
you.
very much. Madam City Clerk, the resolution is passed. Moving on to item number 13, resolution to denounce stigmatization, hateful racism, and xenophobia during the COVID-19 pandemic. And I'll turn that over to Mr. Salty and our city manager.
Okay, so I am going to take you through some information that we included in the staff report as well regarding this resolution. The first is that clearly COVID-19, the pandemic, has really increased stress and feelings of isolation and depression around the world. And that fear and uncertainty around COVID-19, coupled with hateful political rhetoric at the federal level, has led to a sharp increase in violence, hateful acts of racism, and stigmatization of particular groups of people, notably Asian Americans. And stigmatization is actually common during disease outbreaks, and it began early on with COVID-19 when it first emerged in China, and it continues to threaten our resilience in Daly City. The World Health Organization has indicated that attaching locations or an ethnicity to a disease is dangerous, and that's why the official name for COVID-19 was chosen. The CO stands for corona, the V stands for virus, and the D stands for disease, and the 19 is for when it emerged in 2019. It is definitely not a Chinese virus, an Asian virus, or the Wuhan virus. The president of the US, however, has referred to COVID-19 as the Chinese virus, as we all know, and many other leaders and community figures have furthered this type of ignorant rhetoric in their own communications. So it's not surprising that discrimination against Asian Americans in particular has followed suit. And it's been documented in increases in hate crimes and other forms of just outright racism. There is the Stop AAPI Hate Reporting Center that has gathered over 1,000 reports of anti-Asian discrimination in just over 1 week. It was established by San Francisco State University's Asian American Studies Department, an organization called Chinese for Affirmative Action, and the Asian Pacific Policy and Planning Council. And it continues to receive about 100 incident reports every day. These incidents range from shunning and verbal harassment to workplace discrimination and even physical assault. And a large percentage involve spitting and coughing at Asian Americans. And what they really reveal is that there's virulent anger and hostility being directed towards Asian Americans. Stigmatization is a serious threat to our emergency response to the pandemic. It furthers dangerous and false information about how COVID-19 spreads. It alters people's perception of risk, and it repeats mistakes in our own history during past emergencies when racism and xenophobia targeted vulnerable groups. According to the Centers for Disease Control and Prevention, or the CDC, stigma associated with COVID-19 in particular is affecting 3 different groups: people of Asian descent, people who have traveled, and emergency responders or healthcare professionals. And it's validated by news reports and social media, even within our own city. Asian Americans have increasingly taken to social media to voice their experiences, and the topics are trending widely. news reports of Bay Area Asian Americans experiencing racist outbursts from their community members also validated. There's national coverage of violent acts against Asian Americans. And it's really just showing how widespread this issue has become in such a short amount of time. And even in Daly City, there was recent backlash, albeit from a small number of people, against medical personnel at Seton Medical Center, potentially spreading COVID-19 in the community. And it just further highlighted how stigmatization can really target all those groups that the CDC mentioned. And the World Health Organization says that the use of criminalizing or dehumanizing terminology, often that assigns blame, it does create an impression that frontline personnel, for example, have somehow done something wrong or are less human than the rest of us. And it just feeds into the stigma, it undermines our empathy, and it potentially fuels wider reluctance to seek treatment among our population. The CDC also has stated, there's a lot of information online, by the way, from the CDC and World Health Organization, but they state that stigmatized groups may be subjected to social avoidance or rejection, denials of healthcare, education, housing or employment, and physical violence. The mental health implications for stigmatized groups are really tremendous. The World Health Organization also indicates that stigma can lead to more severe health problems, and it can hamper our efforts to control a disease outbreak because some people might want to hide their illness to avoid discrimination. In Daly City, as we all know, we are an immigrant community. More than half of our population is actually foreign born, and more than half is of Asian descent. And we really celebrate that diversity year round through city-sponsored events, even our new Love Not Hate event. And I know that everyone on our city council is very concerned for the well-being of our residents that might be facing discrimination. And so we're doing something about it. The first thing is that we are launching a campaign with our local businesses to boost awareness of stigma and to create what I would call surround sound marketing or messaging around tolerance. Over 200 of our posters that say Daly City Stands United Against Hate are being mailed to local businesses with a cover letter encouraging them to display the posters in entrances or storefronts. Even for businesses that are non-essential and closed right now, we're hoping to see them in storefronts. Imagine how impactful that would be just driving down Mission Street and seeing them in all the windows. Those types of visual cues can go a long way to reinforce the positive messaging. And in addition, we've already had anti-stigma messaging on our homepage at dalycity.org, and we'll continue to feature similar content in upcoming mailers to residential addresses and businesses that we have planned regarding COVID-19 resources. So we're folding in the anti-stigma content. Our new weekly public service announcement videos featuring the mayor and vice mayor and city leadership will also fold in information there. And our police department is continuing to monitor incidents of hate crimes and other violence and discrimination against Asian Americans and immigrants and healthcare workers as the pandemic progresses. So one of the recommendations in messaging around stigma during a disease outbreak from the World Health Organization and CDC is to spread the facts and to stick to the facts, and also to amplify the stories and images of local people who have acted as heroes, like first responders or medical personnel. And we are already planning to do that. So we're planning positive news stories now to fold in among all the other important education on COVID-19 awareness. So I think in the end, the fact that stigmatization is happening here in the Bay Area, we've long been known as an area to be an area of tolerance. It really underscores the importance of speaking out against it. And Asian Americans do not represent a greater risk of spreading COVID-19. Medical personnel that are on the front lines and caring for patients with COVID-19, they're our neighbors, they're our relatives and our friends. They have to be granted our unwavering support because they're sacrificing so much to care for us. So the resolution before you allows you to speak out against all forms of discrimination, especially now, because during the pandemic, it will hurt our recovery efforts. And I am available for any comments or questions you might have.
Wow. Thank you very much, Stephen. What a history lesson. I thought I knew it all, but I continue to learn all the time. I had no idea the connotation of COVID-19 and how that came about, but thank you for that. Are there any other comments from my colleagues?
Mr. Mayor, may I just make a short one? Thank you, Stephen, for the great report. Being that this is Passover and always the Jewish community and others have always stood up against racism and xenophobia. I don't know what else to say other than we stand in solidarity with our beautiful Asian community against racism and xenophobia. And in Daly City, we celebrate them rather than for them. We stand with them, and we'll make sure that they are taken care of. And I want to thank all the mayors, including yourself, Mr. Mayor, for signing already in advance, all the ones in our county. So, and taking a stand, our elected leaders. So I appreciate that and stand in solidarity.
Thank you, Councilmember DiGiovanni. Any other comments at this time?
I'd like to make a comment, Mayor.
Please.
Again, Stephen, thank you for that thorough report. It covers everything from facts to the psychological effects that what happens, because a lot of times people think racism is just this idea, this lofty idea, but it has some real life ramifications to microaggressions that Asian Americans may be going through. So I want to thank, again, people in the county, the staff for putting this resolution. I just want to say shame on the president for naming this with his stereotypical ignorance. It's embarrassing that we have a leader that wants to spread this hate and people actually follow what he says. And shame on him for saying that. Because a lot of times when we think about Asian Americans, you could get either one of the two. It's either they're the model minority or they're the perpetual foreigner, and we are seen as being othered. And a lot of times people may not be thinking it doesn't affect Asian Americans, but in all honesty, it could affect people like my son, who is a third, fourth generation Asian American, and he cannot change the way he looks. And people view him as a foreigner, even if he was born here in the Bay Area. So when we talk about how deep this racism is, it has its lineages in terms of the creation and the stigmatization of Chinatowns in San Francisco and other Chinatowns as being the ghetto, the place where it is dirty, and its associations with illnesses and stereotypes with that. And I also want to just, I really hope, I know that Jefferson Elementary School District just approved, I was there with the vice mayor, they approved ethnic studies in Jefferson Elementary School District. I don't know if it's going to be rolling through, but I think one is to do the messaging, but the other part is also education, and to understand that stereotypes do happen. That is nothing to be joking around with. That name calling, we would always say bullying, and that is just code words for different things like racism or homophobia. Let's call it what it is. And what the president did is a very racist act. And I'm glad that Daly City and our county is stepping up and to control our own narratives, especially with this town and city being a pretty majority Asian American community. So I applaud everyone that put this resolution together. So thank you.
Thank you, Dr. Rod. We have some unsung heroes here, and I want to take the time to acknowledge our vice mayor. Through the San Mateo API caucus, they put out a press release that was signed by all mayors throughout the 21 cities. But before this press release can go out, it was the vice mayor who wrote the language for this press release. And it was the vice mayor and who approached the staff here at the city, our city manager and our city attorney, to get this resolution going. To my knowledge, we are setting the example because we are the first city to approve such. So kudos to you, Vice Mayor, for your passion and how much you care, and especially for people. And Stephen, thank you so much. I had no idea as to, again, how the name was derived. And it shows me that given a task, how much you are basically a bulldog and you'll go right at it. So thank you so much, and everyone here. Okay, any other further comments? Hearing none, I'll entertain a motion to put this resolution through. I think Vice Mayor, if you're still there, you should make the motion.
Mr. Mayor, I'm happy to introduce the motion for this resolution. I also want to say thank you to everyone who put their hard work into this. You know, our city is great with diversity and really a place that everyone calls home from so many communities and backgrounds. And so when we see hateful actions, we don't stand and tolerate for any of that. And I think I know with each and every one of you, from administration all the way to my colleagues here, that we're going to stand firm and let everyone know that this is not what we stand for in Daly City. So thank you, Mr. Mayor, for allowing this on the agenda today.
Thank you very much, Vice Mayor. Okay, so motion by the Vice Mayor, is there a second?
Second.
Dr. Rod, second.
Aye.
Councilmember DiGiovanni.
Aye. Oh, am I voting?
Okay, so we have.
No, I was just trying to give Rod a chance to second it because it's very, very, you know, for his son, his children, Justin's children, and things like that. So I didn't want to interject and second it. So thank you, Mr. Mayor.
All right, thank you so much. So we have a first and second. Any further discussion? May I have a roll call, please?
Ms. DiGiovanni,
Aye.
Ms. Manalo,
Aye.
Dr. Rod,
Aye.
Mr. Buenaventura,
Aye.
Mr. Sylvester.
Aye. Okay, the resolution has passed, and thank you very much. All right, I'd like to move ahead to public appearances and oral communications. I'll first defer to Stephen. Do we have any public communications or oral communications?
Okay, let me just refresh our website for a second here. The only other comment we received in writing beforehand, it's lengthy, but it's about back rent. And I think you all saw it in an email that was forwarded by the city clerk's office. I don't know if you want me to read everything here, but basically the question is Daly City Council going to pass merely a rent deferral resolution or a rent moratorium resolution? Merely deferring rent would allow back rent to accrue. A moratorium, on the other hand, would waive rent for April and May and beyond if the shelter-in-place order extends beyond May until it's lifted and people are allowed to return to work. This person, Ronald Shaheen, is urging you to adopt a moratorium on rent, not just a deferral. So yeah, it's calling for the moratorium. He's saying that a deferral will very likely result in a rash of Daly City evictions and an increase in local homelessness later this year or by the end of the year, and that he would be one of them among them. So he's asking you to waive rent during the shelter-in-place period.
Okay, thank you. To create some sort of resolution or action to not defer, but to waive. Okay. Did my colleagues also receive that correspondence?
Yes.
Okay. Okay, got it. That was a comment made. And if anyone wants to move forward, please let us know. We can agendize this item if we have to for discussion and further review. Okay, are there any other public comments, Stephen?
Nope, we are good to go.
Okay. Okay, thank you. All right, so that's public appearances and oral communications. The next item is appointments, board, commission, membership, committee assignments, and appointments. Anyone?
Yes, Mr. Mayor, I have an appointment. I would like to appoint Francis Espiritu to the Small Business Commission, so that's my motion.
Second?
Okay, so we have a first and a second. And anything further? Discussion? Madam City Attorney, would this be a voice vote or
Oh, it's fine.
a voice vote?
Yes.
Okay, all right, voice vote. So on the motion for Mr. Francis Espiritu has been first and second for the Small Business Commission. Roll call, please. Oh, voice
No
vote.
roll call.
Okay, all those in favor say aye.
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 Any opposed? Any abstentions? Motion passes. Vice Mayor.
Yes?
Yeah, you put your hand up when Councilmember Buenaventura put his hand up, so we're still on appointments. Do you have
Oh,
any?
I seconded his
Okay.
motion. Yeah.
Oh, you seconded before he spoke.
Oh, I didn't know that. Oh no, the hand raising was earlier on. Before it wasn't. When I was not on video, I raised my hand for something in like agenda item consent a while ago. So sorry about it.
Okay. Are there any other appointments to boards or commissions at this time? Okay, we will move forward. Next item is reports. Item number 14, council committee reports.
Mr. Mayor?
Yes, Councilmember DiGiovanni.
Yeah, may I report that we had a CCAG Zoom meeting, and that is our cities and councils of associated government for those listening. And some of the main points that was discussed that night was there was a climate bond that, as you know, was going to go forward based with our Assembly and Senate. And now it's up for discussion. And if they do a bond in November at all, the state electeds, then it would only be used for economic stimulus purposes, but nothing's been decided at this time. Second thing of highlights of the meeting was there was a presentation by Streetlight. Streetlight is an application that some cities have already entered into, like South San Francisco and City of San Mateo, but Daly City had not, and it was called for a vote. And what it does, it aggregates data for different applications for traffic mitigations and such forth. But I had asked the person doing the presentation, had they spoken to someone in Daly City? And they said with Mr. Richard Chu. Prior to the pandemic, I wanted to make sure that was clarification. And he actually, said that not at this time. So after looking and listening to before the vote came, listening to the details, and a lot of cities were concerned because we were in the middle of this pandemic. Why are we having this start at this time? That they did reach an agreement to have a 6-month wait before it started for those that wanted to participate, but it was rather expensive at the time. So taking that into consideration with the monies, the situation, and the fact that Mr. Chu, who I trust in decision, I voted no on that particular issue. So our next meeting is May the 11th. So I thank you for the time. Thank you.
Okay, thank you, Councilmember DiGiovanni. Do you have any more?
No, that's it. Thank you, Mayor.
Sure. Okay, that was CCAG. Okay, any other colleagues have anything else? Council committee reports? Okay.
Sorry, Mayor.
Dr. Rod.
I was wondering is it too late to go back to appointments?
Madam City Attorney, can we go back to appointments?
We can go back to appointments.
Okay, great. Dr. Rod, you have the floor.
Yes, I would also want to make an appointment as well for Paloma Concordia for the small business applicant.
Second that?
Okay, we have a first and a second. Are there any further discussions?
Yes, Mr. Mayor, I
Yeah.
support Dr. Rod Das Magbaal in having Paloma Concordia on the Small Business Commission. She is specializing in public relations and is really there in the community. What she does is she creates public relations stories, and I think that will be really fruitful for City of Daly City to have her on board. She has over 20 years of experience with a diverse network of resources. She founded the company in 2009 and I remember when she said she was happy that actually her business license is in Daly City. And although she lives in Broadmoor, she wishes she was part of Daly City, but her business resides as the business license. So she will be a huge asset. So I definitely agree with you, Dr. Rod, on your recommendation appointment.
Thanks,
Thank
Vice
you.
Mayor.
And may
Yeah.
I make a comment as well? Isn't that Vice Mayor? It's great because she's isn't affiliated with our great 7 Mile House with Vanessa.
That's correct.
Yeah. Yes.
Yeah, that's fantastic. Yeah, which everybody loves. Thank
Okay.
you.
Great. You know, the name, I think I've heard the name and I may have met this person. And I think she's been wanting to take part in Daly City some way, shape, or form, but what was holding her back is Broadmoor. So I'm sure one of these days I'll run into her and I say, oh, you're the one. Okay, great. Just my comment. All right.
Yeah. And one last comment. I know
Yeah.
she does work with Cultivate Labs with their seed accelerator for businesses. And so there's definitely ways she can input to help our small businesses here in DC. So thank you, Dr. Rod.
Thank you, Dr. Rod, for your nomination. So with that being said, we'll take a vote. All those in favor of appointing, what's the name again, Dr. Rod?
Paloma Concordia.
Concordia. All those in favor say aye.
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 Any opposed? Any abstentions? Okay, thank you, Dr. Rod, for that. Going back to, you're welcome. Go ahead, Dr. Rod, you have something else?
Oh yeah. So I attended a Zoom meeting for the Peninsula Clean Energy. It was a very fruitful discussion on branding and coming up with like a vision and mission statement for Peninsula Clean Energy. So we completed that. We're trying to find ways of making it having brand notoriety amongst their customers in San Mateo County. And also, I don't know, I still have to talk to some of the folks at PCE if it's too late to nominate citizen advisory committee members to PCE. I know they had a deadline yesterday, so I want to see if they could extend it just because of like what's going on in terms of COVID-19, and see if we could extend the deadline. So I'll contact them to see if we can get anybody to represent our area within their citizen advisory committee. That's it.
You know, Dr. Rod, thank you so much. I served on that committee before, and when you say it was very fruitful, I don't know, I mean, over 3 hours for a meeting and information that goes over your head and don't understand, I have to commend you for hanging in there. I do know about the Citizen Advisory Committee, and that's the problem that we have in Daly City, and that is we have to become more recognized, and equity is the issue. And I'm sure all council members, you know, when you go to these meetings, you have to make sure you're there to represent Daly City, and we have to get our part also and not be thought of because we're so far north, or maybe our social economic levels are very low and we don't matter. We do matter. And saying I got from Supervisor Canepa, you know, size matters. So it's good. We're one of the biggest cities, and thank you so much for that. Okay, any other city council meetings, city council reports? Thank you. Oh, by the way, thank you, Councilmember DiGiovanni, for that report.
Uh,
Okay, moving on. Item number 16, City Manager report out. Says
Oh, Mr. Mayor,
yes. Vice.
I'm so sorry. There's one item I do want to bring up with the council, and I know that Stephen can help us with that, and the importance of continuing to ensure that we have our census numbers.
Oh,
And
yeah.
so I know
Okay.
that COVID-19 has been, really on the front of our minds, but we still need to have our numbers counted and everyone needs to be counted. And so therefore, just want to um, have the information around where we are at. And I think there's good news that there's an extension that will happen, I believe, till October. But nonetheless, I think during this time, let's keep pushing, having the census and everyone being counted, because we all know how important that is for whether it's in education, it's in funding for our infrastructure, businesses. I mean, I wanted to ask Stephen where we're at on that. I know the mayor and I are on a subcommittee, and also would like to see how we can create a virtual subcommittee soon, Mr. Mayor, on this. But I defer to Mr. Stoltz.
Okay, so I am actually really happy to report that we're doing really well with our response rate. We do have many more months to go to encourage people to fill out the census. But I'll tell you how we have reformatted our outreach methods during COVID-19. But to start with the numbers, this is from Friday, so the numbers are already outdated, but the last county report is from April 10th, and it shows a 53.7% response rate in Daly City. That is fantastic, actually, at this point in time, because the county is at 57%, California as a whole is at 48, and the nation's about 48 too. So we're doing pretty good. San Mateo County overall, second best county in the entire state of California in terms of response rates. Santa Clara is ahead of us, but by less than 1 percentage point. And just as a reminder, about half of the cities in San Mateo County do have census tracts that are classified as hard to count or least likely to respond. Daly City is generally grouped with them. And the other places that are in that group with us are East Palo Alto, North Fair Oaks, and some unincorporated coastal areas. But we're actually doing really well in comparison. We're 12 points ahead of East Palo Alto, 7 ahead of North Fair Oaks, and quite a lot ahead of the coastal areas, which have lower response rates. So it's all good news, but I do want to remind everyone watching that we still have a long way to go. And one of the areas in Daly City has actually been flagged as one of the lower response rates for census tracts in the county. And it's the census tract that basically is home to Westlake Village Apartments. They are the 7th lowest response rate in the county out of 10 that are being tracked. And so far, their response rate is about 41%. All large apartment complexes are hard to count to begin with, and the county had already been planning to do door hanging and that type of thing in large apartments, but with COVID, we're kind of shifting focus. So the good news is that there's targeted social media ads and digital ads in these top 10 census tracts. There's a direct mailer that goes out probably next week to all residential addresses in the county. They've been doing a lot of TV and radio interviews in Chinese media, which primarily affects North County. They're setting up phone banking. They're coordinating that through the United Way Bay Area, which has the big contract for census outreach in our area. And they're prioritizing those top 10 census tracts. And then we're going to work together on reaching out to management at Westlake Apartments to see if we can get some information out to residents there. There is a local partner called Healthways, Inc. that is funded by the County of San Mateo. And I've already touched base with Vinny Acevedo, who I'm sure many of you know, that we're going to target using Healthways through phone banking to the apartment complex and maybe work on some other things in in going to the management of the apartment complex together. So I'll keep you posted on that as things progress.
Thank you so much. Appreciate the update. And I know that you're working very hard on this ever since. So I appreciate all of your hard work. And I know you're finding ways to reach out to those areas in Daly City that need more attention. And hopefully now that there's an extension, our percentages keeps going higher, but I know there's good work ahead. Also, I believe PBRC is also doing work around the census. And I think they are in the same manner doing phone banking to reach out to hard to count population. So thank you.
You're welcome.
I want to say, Stephen, excellent. In a way, I was hoping I'd go first because I was on the county call today and they talked about how well San Mateo County is doing on the census, but you broke it down even to the particular tract. And oh my goodness, again, it's just like a pit bull, you'll go at it, and excellent information. And I guess I came up with another euphemism. You can run, but you can't hide. So good job, Stephen. Thank you, Vice Mayor.
Mr. Mayor, I'd like to say yes, because there's 10,000 apartments, as you know, Stephen. So you are correct. It's a big one, and then that we have to have everybody counted. So I really appreciate your hard work and your outreach.
Great, thank you. All right, any other comments? Okay, the city manager who's been ready to go at it. Ms. Maltby, city manager report, please.
Thank you, Mayor and Vice Mayor and council members. I won't belabor this. I have to admit that I normally, when I report out, I'm very brief because this is the council's meeting and it's the community meeting. But I did provide, I think, a 4-page document to council, and I also wanted the community to see all the leadership that's happening from the council level down. It's pretty amazing. I think it's very easy to be a fair weather leader. And I think that obviously this is not fair weather right now, and to see people's true colors come out and for them to be so beautiful, I don't mean to sound overly sentimental, but I'm very proud of the work that's being done right now. You know, I recently was asked about the city's mission statement, and I thought, you know, this mission of our organization is really driven by our community, and each of our city council members are elected to represent each part of the community and different groups. And we don't always agree, and that makes really good government. But right now, I really just want to say I'm just so proud of the leadership that's happening at all levels. I'm proud of our community for getting on board, for understanding that we need to do things virtually, for the council and the staff. You know, our first responders, obviously our firefighters and our police officers and our water wastewater operators who are making sure that that we have clean water, and all of the things that make it seem like things are normal right now when they're not. And I'm just ever so proud. It's my honor to be working in the city, and we are open to feedback. So we do have so much information. I'm not going to go into my memo at all because it's a public document and people can read it at their leisure. But if there are ever suggestions, we are open to them. Our mission is to serve, and that's from the city council and all ranks of the organization. So I'm happy to answer any questions. I just, you know, this has been a tough go, but I'm just super proud of the work that we're doing, and we're continuing business, and it's also social responsibility, such as reflected in, you know, our advocacy for the census and the anti-xenophobia resolution. It's stuff that I think we all should be very proud of. That's all that I have.
Thank you, Ms. Maltby, for basically advising us and reiterating. It is obviously, and it's clear to me, and I'm sure I speak for the rest of this council, We made the right choice. And you never seen a grown man cry, so I think I better stop talking. But we love you, Shauna. Keep up the great work. We see what staff, they've stepped up to the plate. They're happy. And these are some tough times. But thank you for sharing that and your feelings about our community and our city and our council. It's very much appreciated. And you know we love you. Okay. Anyone else? Councilmember Di Giovanni.
No, well said, and just echo the sentiment. And tough times, but pulls people together. And that's what we really need to do, and show the community that how much we love them and care about them. And I appreciate the staff and everyone's hard work.
Thank you so much. All right. I guess I don't have any adjourned memories. I was keeping a list for the past 2 weeks, and basically I received a list of the obituaries of all those who passed in Daly City. Not to say that it was because of this current virus, but for other reasons.
Mm-hmm.
I'm sorry I don't have the list with me, but I count about 8 or 9 folks within the past 2 weeks. So, in absence of that list, I at least want to make a mention, memorial mention that we adjourn in their memory and their passing for our city. So, with that being said, this meeting.
Mr. Mayor, would you add the COVID patients and all the teachers? There's a lot of them that passed away, the firefighters and police.
You know what, Councilmember?
All COVID.
You know
right?
what? You know what, Councilmember Di Giovanni? That's a good thought. Matter of fact, for all COVID folks who have succumbed to this virus throughout the world.
Thank you.
The last that I checked, I think we were up to 1.6 million. And in San Mateo alone, I think we were up to 653 with confirmed cases, with 21 that has left us. So if we can pause for a brief moment of silence, I would appreciate it. All right, thank you, my colleagues and staff and city manager and city attorney. Thank you for everything you do. You folks have a good evening. Stay safe, and to the community, stay safe and healthy as well. And we'll see you at the next meeting. This meeting is now adjourned.